Riley's diagnosis has impacted me in so many ways. To try and go to work, to try and send him to school, to try and do all the housework and keep all of that going, and deal with the appointments, the phone calls, the MRIs that he hated, that filled him with so much stress, filled me with so much anxiety before we went. It was, and obviously then waiting for the result and knowing that I was probably going to have to wait a week before somebody called me and went, "You're okay, don't panic, nothing's changed." Yeah, it was really hard to learn to manage that, and I still wobble about it sometimes. You know, when he goes for an MRI now, I still think, what if it's changed? What if it's gone back to how it was? What if they're going to tell me it's grown and now they've got to take it out? You know, it's always that what if never goes because they couldn't remove it. It's always there.
So Martin and I reacted very differently to Camille's diagnosis. I literally didn't want to know anything. I have never seen, even 15 years on, I've never seen one of Camille's scans. Martin and my father-in-law had to go to the meeting with the neurosurgeon because I literally couldn't. I was a complete mess. I got to the point where I was literally begging Martin to make this better, find a way to make it better. And because he's so solution driven, I felt he was the best person to ask that from, because even though neither of us had any experience in oncology, I knew he would do everything he could to find a way, whereas I knew if I started looking at data, it would just drag me down even further. There's a lot that Martin didn't tell me, and I'm really grateful to him to this day that he didn't tell me, because I honestly don't know how it would have gone, how my path would have gone. I know I would always have been there for Camille, you know, but I think my mental health would have been really challenged if I'd have known just how bad it was.